Is the Eastern Cape Provincial Secretary for the Nursing Unit at DENOSA, the Nursing Union DENOSA. Khaya, good afternoon to you. How do you see it? What do you actually want to happen here? The Health Department says it simply doesn't have the money.
Good afternoon, Stephen, and to the newsroom viewers. Stephen, as DENOSA representing nurses in the Eastern Cape, we are hearing the same reason given by Head of Department just now, Dr. Wagner. They are crying poverty, that there's no money to employ or to extend the contract of these COVID-19 nurses. But ours, Stephen, from the beginning, we said as DENOSA and organized labor in the Eastern Cape that these nurses must be employed on a permanent basis, because before, Stephen, the COVID-19 arrives in South Africa, in particular in the Eastern Cape, were faced with many challenges. Shortage of staff was number one, and then poor working conditions and poor infrastructure. So when these nurses were contracted, we were happy because they were adding to the already limping healthcare system. So ours is for them to employ permanently, because even if they are employed, Stephen, there will still be a gross shortage of staff. Because remember, this is a historic challenge we've been having for the past 15 years or so. We've been crying about non-filling of vacant posts, non-employment of those who are leaving the health system. So it's a crisis, we're in a crisis.
So, I mean, we accept that we're in a crisis. No one denies that. We know we're long before COVID-19. I mean, for 30, 40, 50 years, health has been in a crisis. But if there's no money, there's no money.
Stephen, we don't believe that there's no money. There's money, but the money is mismanaged. There's a big deal of misappropriation of funds in the Department of Health. There's a damning report from the auditors how the money is being misused in the province. There are holes which we think we need to first close, and before we say there's no money, because the money is being spent irresponsibly. Is not spent where it should be, and the money, if you remember, Stephen, in the previous years, we used to have a habit that every year the money would be taken back to national treasury because it's not being used by the Department of Health in the Eastern Cape. So we don't believe, Stephen, that there's a shortage of money, but the money is not being used properly.
It's really bizarre that this problem comes up, because you would think that everyone in the Eastern Cape Health Department wants health to work. So, I mean, where does the money go then? I mean, how can money be returned? Is it just incompetence? Is there something else?
Yes. Stephen, it's a combination of a number of factors. It could be incompetence. It could also be that there's a serious undermining of the senior management by those who are supposed to be implementing decisions. Well, what is shocking us, Stephen, every time we meet the provincial Department of Health, they give us a report that they've done 1, 2, 3. But when it comes to the lower levels, like districts and hospitals, there's non-implementation. So it's either incompetence or undermining of the senior management, which is now at the end of the day, it compromises the healthcare system, whereby things when supposed to be done, they're not done. For example, if you go also to the clinics, I'm sure you're familiar with that story, Stephen, in the previous years, that Eastern Cape was always running short of medication in the clinics and hospitals. But when you go to the depot, where there's a depot where they're supposed to collect medication is full there, but nobody's collecting it. So is it a systematic problem that the medication doesn't get to the rural clinics, or is it undermining, or is it lack of resources? There are no cars to fetch the medication. So it's a serious challenge, Stephen. It's administration, we take it as poor administration, poor infrastructure, a lack of implementation of decisions taken by seniors. When we sit in the meetings with the senior management, we agree, but to our shock, none is happening when it comes to the lower levels.
So none of this is happening. How many nurses are affected by this? Now, these are people who worked during COVID-19. They have no work now, so they were used when they were needed. They were used in a situation, they helped us get through an emergency. Now they have nothing. They've gone to Tshwane.
The total number now, Stephen, which has been affected by the contract is 631. That has dropped from around 900 and some, or close to 2,000. And HOD said, Dr. Wagner, that the past 2 years, some have been managed to be employed permanently in the system, which is a quarter of that number. But unfortunately, still 631 which are still outside, which are now still affected, which are affected by the termination of the contract. But it's not only nurses as well, Stephen. I think the total number of healthcare workers initially were sitting at 8,300, but we're told that number has now dropped. Because remember, it includes doctors, it includes all other allied health professionals, your radiographers, your physiotherapists, speech therapists. It's not only nurses, it's a whole lot, it's close to 8,000 in total. But the portion there of nursing is about 631 as today.
What it also tells us, I mean, we've known, particularly in the Eastern Cape Health Department, for a very long time,